Good day, everybody, and thank you for joining us for this current day topic, whereby we'll be speaking about public health issues during major events and the outlook for the Paris 2024 Olympic Games. So I am Marie Amsani, and I'm very happy to be co-moderating the session with Leonidas Dexatis from the OECD. And he has a master's in health and international medicine, well-versed in dealing with disasters and international disasters. He works for the CDC, so that's the Center for Disease Control. He contributes to the detection of health threats in the context of mass gatherings, and he has been involved in humanitarian missions with Médecins Sans Frontières. So welcome, everybody.
So I will present Marie. Marie is the project manager for mass gatherings at Santé Publique France. She has several years of experience evaluating prevention actions, including vector control and parenting support programs. She joined the Alert and Crisis Coordination team at Santé Publique France during the COVID pandemic. And in early 2022, she became the coordinator for the Santé Publique France's preparation for mass gatherings. She has prepared the mass gatherings for Rugby World Cup in 2023, the Olympic and the Paralympic Games in 2024, focusing on surveillance, prevention, and post-event legacy and lessons learned.
Merci. Donc, comme vous pouvez vous en...
So thank you. As you might have doubted, this is going to be a session held in French and English, and we're going to be hearing from several foreign speakers who are here to share their experiences of the Olympic Games. And this is why we have headsets that are available to you, and this will enable you to follow the entire session, both in English or in French. So you will be able to follow up in the language of your choice, and that will mean you'll be able to follow up on all the presentations and exchanges. I'd like to thank all the translations, the entire translation team, as well as the SPF for France, who was involved in organizing the session. And so I'd like to thank Clotilde de Menton, Roxane Curtil, and Cynthia Tamanjo and Justin Schaefer from our infectious disease department. So 42 days. In 42 days, we'll be having the opening ceremony for the Paris Olympic Games for 2024. And this will be the beginning of a summer filled with sports and festivities and good health for those who will be present, both residents and tourists alike in France. And so we have several challenges, and we have to keep an eye on diseases, early warning systems, and given the fact that it's going to be mass concentrations of people in the same place, gathered together in the same place. There'll be prevention and management measures that will be required. We're going to need fluid communication between all the different stakeholders. And so the initial approach for a mass gathering means we might be dealing with the emergency medical interventions. And so there's now a definition of what a mass gathering means, which is the following. So mass gatherings are events which entail the concentration of people in a given venue with the given objectives and over a predefined period of time. It may put planning and intervention resources under pressure. And so a mass gathering, according to the said definition, can be a spontaneous gathering, like a protest march, or it can be something as planned, such as the coronation ceremony of King Charles in the UK. And so it's something that's planned or it can be spontaneous, but it's something that moves, as does the mass gathering that we're interested in today, which are the Olympic Games. The question is, when it comes to the preparation of the Olympic Games, what does it actually mean in terms of activities, actions, health preparation? What are the risks that lie at the heart and that we should be particularly attentive to for those involved in the preparation? And what are the opportunities for this type of gathering? What can we learn from this unique opportunity in France? This is the first time in 100 years that we will be hosting the Games. And so we'll be hearing from different speakers. We'll be hearing about the challenges, experiences, as well as the heritage that the Olympic Games leaves behind, as well as how we prepare for other mass gatherings, whether they be held at a local, national, or international level. We're going to be looking at how we prepare the extent and the magnitude of the preparation and what's gone into the preparation of the Paris 2024 Games. And so our guests today accepted our invitation to be with us today at the Beffroi in Montrouge, and they'll be sharing with us their experience. So there's Tina Hendricks from the UK House Security, and then Thomas Saito. And then we have two guests that come from further afield to share their experiences in terms of how they prepared for Summer 2024. With Philippe Levan, who is head of the Olympic Games and Paralympic Games Organization Committee in Paris, and Céline Casero-Schumann, who is the representative from Santé Publique France. And so before I present our first speaker today, each of the four speakers will have 15 minutes to provide for their presentation, and then we'll have some time for Q&A, and then we'll have a roundtable discussion after the break, and we will welcome two other guests to the panel, and this will enable us to broach new subjects, and we will have questions and answers. And so I'd like to start by introducing our first speaker, which is Tina Hendricks.
In global health security for over 15 years to help improve global health security and help countries meet the international health regulations. One of the key focus is supporting safe and healthy delivery of mass gatherings for providing critical advice to those planning mass gathering, such as France, by helping develop evidence base, building capacity, ensuring a positive health legacy. She was Program Director for London 2012 Olympic and Paralympic Preparedness, including public health surveillance and response diagnostics, emergency response, and exercising. She provided advice post-London 2012 to different events such as the Commonwealth Games, the FIFA World Cup, Rio Games, Tokyo Games, and today to France. So Tina, the floor is yours. Thank you very much.
Thank you very much, Marie, and I'm actually really impressed that you're here doing this today. I don't think I would have been before London 2012, but it's an amazing opportunity to come and share our experience. And as Marie says, part of the job is then carrying on that tradition of sharing the learning and experiences and supporting other people doing future events. I'm going to make sure I press the right button here. Yes. Okay. I'm very aware that this is Friday afternoon, post-lunchtime, so I thought I'd start off with key messages in case people want to have a kind of like bit of downtime afterwards. But it's a real pleasure for me to come and do this. It's a real kind of passion of mine about the Olympics and making sure that they work well and are successful. And it is tough in the lead up, but it's the most amazing thing you'll be involved in. If you get the opportunity, I would recommend it. Putting together this presentation brought back some memories, mainly very good, but also a few kind of like issues that came up, and some of which I will share with you, because I think it's good to have the reality of what happens on the ground, not just the sanitized events. It was 12 years ago now, see, just blurs. But, you know, it stayed with us, and it's been a huge legacy within the UK and strengthened our public health systems. So just to highlight some of the challenges around hosting an event of this size, the scale of things. You've got 204 nations coming into France from all around the world with different health systems, different kind of concerns and issues, so huge numbers of people. 24,000 athletes and Olympic officials who will have kind of like all the treatment that they want to have and be looked after really well. But it's actually kind of like the people who are coming to watch the events that are more likely to cause some concerns. You'll have the world's media here. You probably already have. So there's about 10,000 official sports media, and then there's about 10,000 other media who will be looking for stories and kind of like learning about Paris and France and how it works. So always a good experience. The term we used was the eyes of the world will be on you at the time, because it is the biggest sports event in the world and everybody wants to see what's going on. And 99.9% of it will be amazing and positive, but it's the kind of things that might throw concerns in there. I did Google last weekend to see if there was any negative media stories, and actually there really isn't at the moment, which is fantastic. We had quite a few more challenges beforehand in London, but that's fantastic. And politics. There is a political element to holding the biggest sports events. There's a reputational issue for France if something goes wrong. And if anything happens anywhere in France, it'll get linked back to the Olympics if it happens during games time. So that's that kind of like setting that scene, really. One of the things we looked at is about kind of need to think about reassurance. That's not what we normally do as public health. We normally kind of report on what's happening, but actually it's the reassurance saying there's nothing happening that you need to be worried about, and actually knowing you've got the data and information and you've got confidence to say that. So that's a really important shift in perception and way of thinking. Expect the unexpected. I've had a couple of conversations earlier on today about, well, what might happen. So as an example for us, not planned for at all, but a couple of weeks before we had our opening ceremony, we had some British farm animals as part of our opening ceremony. Somebody put their hand up and went, well, what happens if they've got diseases that might be zoonotic? So we then had to produce a 40-page risk assessment to say they're the cleanest animals ever. So nothing's going to happen. But, it's that. We hadn't thought about it because why would you? But it's kind of like things like that will come out for public health. There'll be questions raised that you're not anticipating. There's a country context. Every country that hosts a mass gathering, the Olympics, has got different policies, processes, ways of working, health systems and structures. So it's not a one-size-fits-all that kind of can get transferred between countries. It's got to fit within your model of working. And there's a commitment when you host the events for the IOC to kind of recognise that and actually fit their health systems into what's already in country. New players. You have the organising committee, the polyclinic. It's people you don't normally work with because they're not normally within the French system. So you have to build up those relationships with them. And also very much about what can this mean? What can you bring to France, to Paris, as a benefit from hosting these events? It's a really expensive thing to be doing. So, benefits within the country are really important. And my last comment is, it's amazing. It brings everybody together. Really positive event, but you have to be aware of all the other things. So, very briefly, public health emergencies of international concern. We've all lived through one of them recently. They do happen. They've actually never stopped an Olympics. They have delayed one, as Tamoya will talk more about. But, it's something that the world kind of it brings the world together. It's a positive thing to be doing. So always trying to be able to kind of continue with these events. But you'll notice the media, again, like to kind of raise it as a concern. But things will happen. All the things that you normally will deal with as public health experts will happen. But you'll have to deal with them quicker and provide the information quicker and that reassurance message in there quickly, because otherwise you get the kind of media that I put up there, because the story will just build unless you kind of manage it very well. So just some reflections on London 2012. We took a very pragmatic approach about doing a risk assessment, what might happen, how likely is that to be, surveillance systems, how good are our systems, how will we know what's going on, and the response about what will you do. It's a planned event. You get told 7 years before you host it that actually it's going to happen, so you can't claim it's an emergency, but also you need your surge capacity. You need the extra people sitting behind you if something unusual does happen. So don't take those people out of their day jobs. They're there to support you if needed. Need to maintain business as usual. You can't have stories about people saying we couldn't have access to health systems, we couldn't carry on doing our normal health service because everybody's diverted into the Olympics. That won't wash. And I will always say that public health needs to sit around the planning table very early on, because public health is a critical component. It will happen. It could really impact the event if there's something significant going on. People need to understand the roles and responsibilities of public health and how it sits within the system. So we were very lucky in London. We actually got to sit around the table. If some of you might know Brian McCloskey, he got us sitting around the table, and that's what we did. So we were always telling them about why public health was important, because it will happen. So our risk assessment was what we got in the country at the moment before the Games, and the epidemiological situation, so around our host population. We also looked at environmental hazards. The organisation we were then dealt with the environmental hazards, so food, water, air, what might happen there. What will be different during the Games, what will challenge them. So kind of the context, the things I've just been talking about, actually does this increase the risk or doesn't it? We needed to look at international travel, what would be coming in. As I said, 204 nations with a very mixed demographic coming in, what could be imported. There is, unfortunately, in the world we live in, the risk of deliberate events. So we were looking at CBRNE and how that could be managed, and looking at whether our systems were fit for purpose. What did we need to strengthen and enhance? So very, very briefly, because you can have the slides afterwards so people can read them in more detail. But just we enhanced a lot of our normal systems. Like yourselves, we had good surveillance systems, so we looked at what we could do to strengthen them. So we put another syndromic surveillance system into our ambulances. We already had kind of well-established systems. We enhanced our international surveillance because obviously that huge concern about the importation. And environmental hazards, we put a lot of work between air quality because of the endurance events. They wanted to know if there was going to be issues that would kind of impact the athletes, but also because of water quality as well for some of the sports events. We put in event-based systems that had a flag on it to say, is this related to the Olympics? So it would come up into the system. I was still getting alerts a couple of years later, which was a little bit worrying, but it's easy to switch things on, but you forget to switch them off. But it was good. We had epidemiologists sitting in the Games polyclinic, looking at their monitoring, their medical encounter forms data, and looking at how they could kind of get that data and respond to it, and encourage reporting and manage people within the kind of like the teams in the village to kind of like, I've heard you had a bit of diarrhea and vomiting. You know, is there something we can do about it? Can we investigate? So it really, really helped. And we also put an undiagnosed serious infectious disease system in some of the hospitals in London because of the CBRN threat. So it just meant that there would be an alerting if people started to present at hospitals with unusual symptoms. We enhanced our microbiology with kind of like additional kind of gastro and respiratory tests. We had daily reporting, nothing to report, which was great. We had single points of contact. So within the agency, we had one number for whoever it was who was on duty, so that everybody knew, all our partners had that number. It wasn't an individual, so they knew how they do that. But because we spend a lot of time working across government, across organisations, trusted relationships as well, so somebody would phone up and say, we're not sure, but can we talk about this with you? It was really good. As I said, we had people sitting in the polyclinic. We did a lot of media monitoring, but there was nothing like the social media you're going to have to deal with this time. It was a different world then. I will say, looking back, we were very lucky. That was a summary of all the things that we put into our daily report. So you can imagine kind of like the amount of data and information that coming through. And that was our flow chart of how we pulled all that information. So it went into our government, but it also went into the organising committee. And this is not for anybody to really worry about, but that shows how complicated, how many bodies were involved in something like the Olympics. The ones with the red circles on were the ones that didn't exist before the Olympics and then kind of stopped afterwards. So they were the people we had to go and build relationships with, so they knew who we were and what we did. So what did we do? We did everything quicker and faster so that when somebody does phone you up, if you've got your Prime Minister phoning you up saying, there's a rumour about this, what's happening, you can say, well, actually, no, there's not, because we know, and we know because of this, this and this. Or, yes, there is, we're investigating, we'll come back to you. It's really, really clear messaging going on. Anything that came through, we had expert risk assessments going on. We did a lot of kind of like sharing information, kind of like our roles and responsibilities. But what happened normally in London? We have kind of about 6 million visitors in London during the summer normally. So things come. things get imported. So, you know, if we say something like there's a case of chikungunya, it's an imported case, no risk of ongoing transmission, don't worry. That took a lot of training upwards, I will say. And we also had to manage rumours because of the reactive and proactive media. Again, we were very lucky because there really wasn't that social media world that we now live in. And resilience, so we had our kind of like surge capacities, our experts on call if something was needed. So what happened? Really nothing. Nothing significant anyway. Nothing. Our daily report had nothing of significance to report on the front line every single day. But it did have about 20 pages of detail of why we knew there was nothing happening and the things that were going on but weren't going to impact. So that again was an assurance of providing lots of information to people so they didn't have to worry about it. We could refer them back to our report. What was critical? Well, mentioned the surveillance and diagnostics, teamwork, team building. We spend a lot of time both within our organisation, getting people together, cross-government, cross-health, the organising committee. That, to me, was the thing that made it work. We knew who we needed to talk to. We had built up really good trusty relationships in the couple of years beforehand. Mentioned about the single points of contact and having somebody in the polyclinic. But what we also had done is spend a lot of time in helping people understand that you needed to have a single version of the truth. Something happened, you want one message going out, whatever channel, whoever's saying it, you want one message going out, and that will avoid an awful lot of confusion and media interest. I've mentioned communications quite a few times. It is critical. So we did a lot beforehand, both internally with external partners, put a lot of website information, WhatsApp group. Well, it wasn't a WhatsApp, it didn't exist then, but kind of like using kind of social media as much as possible. And kind of like you use media to kind of like collate and inform people. So we did a press briefing a couple of weeks beforehand saying this is everything we've been doing. These are all the additional kind of like tools we've put in place, testing, assurance, communication piece. And that was really good. So it means it stopped an awful lot of the challenges coming in from the media as we went through. The March of the Killer Caterpillars was an unexpected message. That was one of our national newspapers, front page, a few weeks before the Olympics. They're about 2 centimetres, 3 centimetres long. They cause a bit of throat irritation. They do not kill people, and they were in the west part of London, away from most of the venues. But it was a good story, hit the headlines, and that's what will happen. An awful lot of testing and exercising.
I'll leave you 2 more minutes.
Okay, thank you. Sorry, I knew I'd talk too long. It's too passionate about it. Did a lot of testing and exercising, and that was all part about people understanding what we did, the roles and responsibilities, but also building up those trusted relationships with people. A whole list of recommendations, everything that I've just been talking about. So I'll do that. Just want to really highlight the legacy and the evaluation piece. Plan to do your legacy evaluation beforehand to do it well. I did it between the Olympics and Paralympics, so but it's around kind of like gathering all that information, that data, sharing it with other people, because actually it is a unique event, but other people are going to be wanting to learn from what you're doing, which is why we're here. So about the things that we improved within the UK, like our surveillance systems, how we worked across the organisation. There was long-term, sustained legacy from this. We also did a lot of publications on the back of it, kind of putting things out there, both scientific publications and reports, and did a observer program during the Paralympics, which is where we had people like Tomoya from Tokyo come along and work with us and learn what we were doing on the ground at the time. And last one. But yeah, so plan for that as part of your work, because there's an amazing opportunity to kind of like strengthen your systems and improve the way you work within public health. But it needs resources, it needs commitment and time to do it. So, I've already offered to help if needs be, but because it's something that we don't do very well. There's not a lot of really good evidence out there. in the world on how you manage a successful mass gathering, the public health elements of mass gatherings. And most of all, enjoy it, because it is the most amazing experience. And it will bring France and Paris together. It's incredible. So thank you.
So thank you very much for setting the tone for this session, underscoring also the necessity for building the capacity and learning from how these math gatherings take place. Now we'll have 5 minutes for questions, and just a reminder for the people online, you can send your questions online and we'll be reading them from here. Maybe someone from the room, if there are any questions. And I guess, yes, then we can maybe go on to the next presentation, which will be from Dr. Tomoya Saito, who is the director of the Center for Emergency Preparedness and Response at the National Institute of Infectious Disease of Japan. He's a distinguished subject matter expert in public health emergency and preparedness and response, and he has served in several expert committees, including the Ministry of Health, Labor and Welfare, the Government of Japan, and the World Health Organization. During the Tokyo 2020 Olympics, Dr. Saito advised the coordination meeting for the COVID-19 countermeasures at the Olympics and Paralympic Games, and participated in the Scientific Experts Roundtable for COVID-19 countermeasures, as well as managed the Emergency Operating Center of the Tokyo 2020 at the NIID. And with that, I would like to give you the floor.
Thank you. I hope all of you are excited to host the Paris Olympic Games later, a month later. So do you have any concerns? If not, you are more focused on the Euro football opening today. Anyhow, 3 years ago, around this time, middle of June, we were truly overwhelmed with numerous tasks. Regarding COVID-19 measures, there were still many decisions to be made. So our Olympics, Tokyo 2020, hosted in 2021, became solely focused on COVID-19 countermeasures. But I'd like to quickly review the public health preparations we made since before COVID-19 and discuss the lessons learned. Please note the views and opinions expressed in this talk are more on my own and do not necessarily reflect the views or positions of these affiliated organizations. And I have no conflicts of interest. So as he mentioned before, I was involved in the Tokyo Games in various capacities. As you see, for the government, high-level entities, and also for the Tokyo Metropolitan Government before the COVID-19, and also for the expert roundtable for the organizing committee. Additionally, I was the head of the EOC at the National Institute of Infectious Diseases, where I was primarily responsible for technical support for enhanced surveillance. Please note that my talk will mainly be from the perspective of an external advisor. The decision to host the Tokyo 2020 was made in 2013. Following that, various preparations began. The preparations became more earnest starting from almost 4.5 years before the Games, when the basic plan for the Games was presented from the government. And ensuring the security of the event, the safety of athletes, spectators, and tourists became important issues. And even before the Games, Japan had hosted many mass gatherings events and high visibility events, but the scale of the Summer Olympics was truly exceptional. This is the overall government structure for the Tokyo Games. The event is organized by the organizing committee, in short, TOC-OG, which includes the Tokyo Metropolitan Government, the Japanese Olympic Committee, and the Japanese Paralympic Committee. But TOC-OG is fully supported by Government of Japan. The Prime Minister led the headquarters for the promotion of Tokyo 2020 with the involvement of various ministries and agencies. So before COVID-19, major concerns in public health preparedness were heat shock, natural disasters such as earthquakes and typhoon, and import of exotic infectious diseases, and mass casualty events by terrorism. Today, I will mainly share my experiences on preparedness for infectious diseases. The important first step to start preparedness is to conduct risk assessment. In 2017, NIID published a risk assessment at the national level, focusing on 3 key factors: potential of importation to Japan, transmissibility, and probability of large-scale outbreaks and high severity. In addition, the need for countermeasures was assessed through vulnerability assessment. Diseases that may be difficult to diagnose in the clinics and hospitals, and those that impose a significant response burden were selected. This table shows infectious diseases that meet criteria, particularly measles, invasive meningococcal diseases, MERS, and EHEC were identified as infectious diseases of high concern. In addition, measles and rubella were identified as diseases that require vigilance against importation, because measles has been eliminated and rubella is close to elimination in our country. Through this risk assessment, we identified several gaps in surveillance. One of the gaps was the early reporting mechanism. Previously, infectious diseases were only reported when pathogen diagnosis was confirmed. During the risk assessment process, we concluded that the system was needed to report to public health authorities when an infectious disease was suspected, even before a lab diagnosis was made. Therefore, in 2019, we started to operate the new undiagnosed serious infectious illness surveillance system. This system specifically involves designated higher-level medical institutions with ICUs. If a serious patient is admitted and an infectious disease is suspected but causative pathogen is not identified, the institution is required to report the case to the public health authorities. The plan for infectious disease countermeasures was summarized at the government level in 2019, a year before the Games, but I don't go in detail because the emergence of COVID-19 drastically changed the priorities of measures for Tokyo 2020. The discussions on COVID-19 measures during the Games began in September 2020. The so-called three-party meeting, the high-level meeting, to which I served as an advisor with Government of Japan, Tokyo Metropolitan Government, and TOGOG, was organized, and this meeting established the framework for COVID-19 countermeasures. So there are many considerations to be addressed. For athletes and game staff, countermeasures would need to be put in place for different environments, such as venues, athletes' village, and host towns. And participants in the Paralympics would have additional or different considerations for prevention and control measures. And decisions would also need to be made in relation to spectators. And in addition to the Games, related events such as the torch relay and live sites are another mass gatherings. For each of these scenarios, we had to consider how to implement preventive measures, conduct surveillance to detect any events, and respond accordingly. But the situation was full of uncertainties. No one could predict what the COVID-19 situation would be like a year later, and it was uncertain to what extent travel restrictions would be imposed worldwide, whether an effective vaccine would be developed, or how accessible such a vaccine would be if it were developed. And later, the situation became even more complex with the emergence of variants with increased transmissibility, such as Alpha and Delta. So ultimately, the measures focused on reducing risk through a multi-layered approach, aiming to reduce risk at each stage of the process and thereby achieve an overall reduction in risk. Many people wanted to solve the problem with one single solution, such as frequent testing or vaccination, but it is not the case. Infection control measures had to be implemented at every stage of the process, referred to as a journey in the Olympic terms. These preventive measures and rules for the games participants were formalized in a document called the playbook. So everyone had to agree to and follow the playbook to participate in the games. So I now talk about the infectious disease response. Actually, I wanted to write the same diagram as Tina presented, the one complex one, but our government does not allow me to use it. So this is a more simplified diagram, but it shows the roles among the involved organizations. The main stakeholders were the government of Japan, including the Cabinet Secretariat and MHLW, Tokyo Metropolitan Government, and TOGOG. But there were various organizations within these entities. And COVID-19 made the situation worse. Tokyo established the dedicated public health center called Tokyo Base of Health Support, and TOGOG established Infectious Disease Control Center to respond to COVID-19 cases. But at the end, these two groups worked together in the same operation room. It facilitated the information sharing and coordination between the Public Health Authority and the organizing committee. So here is an interim summary of COVID-19 cases after the Olympic Games. The green indicates cases in athletes and surrounding staffs. And the majority of this category were overseas visitors and detected by the screening test. And other stakeholders were mostly domestic stakeholders and detected by visiting clinics after they developed symptoms. The blue line shows the 7-day rolling average in Tokyo City outside the bubble. So as other stakeholders indicated in red, live and works in the Tokyo City outside the Olympic bubble, they seem to be affected by the local increase of epidemic. But those inside the bubble, most of them seem to be imported cases and contained effectively. Let's look at daily effective reproduction number. It's the indicator of force of infection in the society. Before the Olympics, the effective reproduction number was growing. However, after the Games began, it gradually decreased. During the Paralympics, as this number became below 1, the epidemic entered the decreasing phase and decreased faster. Overall, there seemed to be no negative impact to epidemic situation in Tokyo during the Games. This figure shows the overview of the SARS-CoV-2 variants at the time. The variant in Japan was very unique, with most of the strains being classified as AY29, which probably originated in Japan from the Delta strain that entered the country around May. And this AY29 is endemic only in Japan. So this AY29 was like a marker of Japanese cases. And there were no epidemic with AY29 outside Japan. That means there is no evidence that the virus was spread to the rest of the world by participants in Tokyo. And no epidemic other than AY29 in Japan means that the virus that was brought in by the participants did not spread in Japan. In terms of other infectious diseases, we are paying close attention to diseases that could have a particular impact to the Games. In addition to the event-based surveillance using various information sources, such as SNS and media, we also effectively utilize the IHR mechanisms. During the Games, Japan's IHR NFP requested information from other countries about events that might be related to or impact the Olympic and Paralympics. And nationally, there were local outbreaks of RS virus, Legionnaires' disease, and EHEC, but they were not different from seasonal levels. Other than COVID-19, no other infectious disease events were found nationally or internationally that could have affected the Games. Here is a summary. Hosting a major international sporting event under a pandemic was unusual and challenging, but we proved it's possible by minimizing the impact to the Games by layers of measures, both in and outside the bubble, scaling down infection control through a playbook, early detection by an intensive screening, early response, vaccination, and other social physical distancing measures. This is an important legacy of Tokyo 2020. So here are the lessons. First of all, risk assessment, management, communication are the standard steps that should always be followed regardless of the situation during normal time or a pandemic. And second, prepare to ensure nothing is happening. So this lesson is actually given by the London Games 10 years ago. I attended the Observer program and I learned this word. And while early detection of events is important, they emphasize that confirming nothing is happening is even more crucial and there's a very high public attention. It's necessary to have a strong surveillance and verification system in place to verify that any events or even a small local news are not a concern. And third, build networks of stakeholders and establish a shared understanding of roles and responsibilities. As you imagine, there are a lot of organizations involved, and you may be not familiar with most of them, especially those inside the organizing committee. There were differences in jurisdiction depending on the area, such as inside the venue or around the venue and in the city. And the jurisdiction of stakeholders also varied depending on the degree of involvement to the games, such as VIPs, athletes, team officials, event staff, spectators, tourists, and citizens. I encourage you to make a great effort to consolidate and coordinate information in the last minute. Building the robust trust is always important. And lastly, there is only 1 month left until the event and 3 months until the end. Despite the highly complex situation, the mission of public health officials remains unchanged: to protect the health of citizens, no matter what their athletes, tourists, or anyone else, as you always do. And in the midst of the uncertain situation caused by COVID-19, everything was unprecedented, and various adjustments continued until the very last moment or even during the ongoing event. Normally, it shouldn't have been so hectic. Preparations phase must be busy, but once the event starts, it should proceed as planned. So please make sure to double-check everything, and I hope you enjoy this special summer event. Thank you very much.
Thank you very much, Dr. Saito, for this unique feedback on your experience through this pandemic that we all lived. We can only imagine how complex the network must have been then in dealing with postponing the Olympics. We'll take a few minutes for a few questions. S'il y a des questions dans la salle ou en ligne. Yes, with the microphone.
In English, thank you very much for your fascinating presentation. I saw, and I'm sure it was a shortcut that you took in presenting your slide, between heat stroke, which is a major concern with us as well now, earthquakes, which fortunately is not, et cetera, et cetera. And you were talking about imported diseases. What about local diseases? How are these addressed? They don't appear, but I'm sure you get meningitis all the time and legionellosis all the time. So how was that dealt with? Business as usual, or was there a special system set up to deal with it? Thank you.
Okay, thank you very much. We just perform the somewhat enhanced surveillance. That usually we see the data weekly, but during the before 2 weeks of the games and after 2 weeks of the games, we check the surveillance data every day for every diseases. That's the only thing we do for the diseases that exist in the country, normal as usual. Yeah.
Thank you very much. There's one more question in the room.
Thank you very much for your presentation. Actually, it's a question for you both. It's about legacy. Tina and Jax, you insisted about the importance to anticipate the legacy and to prepare how to what to keep from the Olympic Games. And so I would like to ask you, what did you keep from the all this preparation, the new systems, and also maybe how did you adjust part of your organization, maybe between Olympics and Paralympics game? I don't know. Yeah, thank you.
Okay, thank you. The legacy building is one of the important part, but at the time of our event, so we were too much concerned about COVID-19, and so that is very unique interventions that we made just during the second year of the pandemic. But looking back to what we did during that time, so we were doing the same thing, just risk assessment, and think the risk management and risk communication. That was always the same steps. And we do the same way in the other mass gatherings or other emergency events after the Tokyo 2020, such as the G20 or G7 summit or earthquakes. Every time we are doing the same way, such as the enhanced surveillance will be doing in the same way. So is that question is the difference in Olympics and Paralympics, or?
I don't know if you had to adjust maybe some parts of your organization based on your experience with the Olympics.
Oh, no, okay. So as for the Olympics and Paralympics, the attention is very different, but the surveillance was performed in the very same way.
Thank you, Tina.
I'll just add to that. Yes, we kept all the systems the same for both events, but we actually pulled back quite a lot of the staffing. So we went down about a third, because our experience for actually during the main Olympics was we watched a lot of sport. And so actually kind of like let people go back to their day jobs, but with the agreement that if we needed, we could kind of request them to come back in. So.
Thank you both. Thank you, Tina. Thank you to Moya for your presentation and your time for answering. It's time to present our third speaker, Philippe Levan, médecin-chef pour Paris 2024 depuis 2020.
Philippe Levan, who is a trained physician. He specialized in sports trauma and medicine. He was a former member of the Medical Commission of the International Paralympic Committee and supervisor for the Paralympic Games of Tokyo in 2020. He was member of the medical team for the Summer Games between 1992 and 2008 and medical head for the Winter and Summer Games between 2010 and 2020. He was also Secretary General of the French Society for Medicine, Exercise and Sport, and he works for the INSEP as a contractual physician, and he's chief medical officer of the Olympic and Paralympic Organization Committee for the 2024 Games. So, Mr. Levan, the floor is yours. Thank you very much for having invited me, and I'm going to be giving my presentation in French. And my apologies for my English to our English listeners, says our speaker. And so I hereby declare that I have no conflict of interest. So the Olympic Games will be from the 26th of July to the 11th of August. I'll give you a general presentation to present the Games. And the Paralympic Games will be held from the 28th of August to the 8th of September. So it's in 45 days' time. Just to remind you what the Games are, it's 10,500 athletes for the Olympic part of it, 32 Olympic sports, 208 international committees, and 31,500 volunteers. And for the Paralympic Games, there'll be 4,400 athletes, 22 sports, 187 international delegations, and 13,500 volunteers. And so it really is a major event, as we said, and we're expecting over 4 billion television viewers, 13.5 million visitors, and people who have bought tickets, 206 nations represented, and also the media, a very important part of it. There'll be over 26,000 accredited media, volunteers, and spectators for the torch relay, or the handing over of the torch. There's also going to be an opening ceremony, which is going to be quite unique because it's going to be held in the city with 320,000 spectators. And this is unprecedented because usually you're in a stadium and you're around 100,000 people. And it's the same for the Paralympic. It's going to be held on the Champs-Élysées, and there's 65,000 people who are expected to attend the ceremony. And so you can see the challenges for public health, especially when you have a public gathering of this magnitude. In terms of the sports, there'll be 28 traditional sports plus 4 additional sports, including skateboard, breakdancing, surfing, and climbing. For the Paralympic Games, it's going to be your standard traditional program. In terms of our contingency plans, and so why do you need a contingency plan? So this is the document which enables you to intervene and to adjust your practices, your operations, when there is an incident that occurs. And so what's important for us is to be able to define the risks. And will the risk affect the people, the environment, the reputation, asset, legal, or operations? And within this plan, we describe what needs to be done and how the teams need to coordinate and share information to respond to an incident. And so what I heard from the first 2 speakers, what's very important is communication. Communication is possibly the most important thing, is communicating both within the organizational committees, but as well as with the outside authorities. So under normal circumstances, what would we do? What would we need to do? We know what we need to do. And the question is, how should we do it? And what happens when you are faced with an incident? So we need to see how to make the appropriate adaptation. So there are examples. For example, you need to provide for catering services. We've got policies and procedures for food safety. And if ever there is any food poisoning, that's when your contingency plan kicks into play. And the same goes for safety and security. And so what do we expect of the contingency plan? It's about describing the situations which will lead to the activation of the contingency plan. It's about targeting the teams that will be involved. And so it's all that we refer to as FAs, the functional areas that will be impacted. Will it be security? Will it be the EVS, so the event venue services? All those who will be there to host the public if you have a heatwave, for example. Or will it be people coming from the outside? So the CIO, the IPC, any public services, and the public safety and health services. So it's very important to communicate about the plan, as well as to be able to adapt it and roll it out at all different levels. And so there are many acronyms, but I'll explain to you as we go along. And this is a part of our contingency plan. And the one where you can see the hands, the shaking hands. So that's where the medical players are impacted with other services. Where you have a cross is where there is a direct intervention. So, of course, I don't have all the plans. You can only imagine the safety and security plans that we cannot show you today, as you can understand. And so these are the generic risks that have been identified within the medical field. So there's external epidemics, for example, heat waves, and that's where I'm going to put most of the emphasis. But there's other ones. There's intervention in the crowds, there's intrusion into the polyclinic, accessibility problems for the Paralympic part of it to certain of the venues. Sometimes you've got complex FUPs with intervention rules that can be also very complicated, and everybody needs to understand them. And there's something we speak about a lot, which is also the water quality risks. And so looking at the infection plan, and this mainly relates to infections other than ENT infections, gastrointestinal infections, and all the other viruses that might occur. And the plan itself is activated on the basis of 3 sets of data that could be flagged. So cases that come directly via the games, the Paris Games, cases that are flagged by doctors, national Olympic committees or the Paralympic committees, or information that's flagged to us via state agencies. So it could be the ARS, but it could also be Santé Publique France, who will be working directly hand in hand with us. In terms of the objective is to organize reciprocal alerts, which will enable us to trigger the contingency plan. And so if ever there's significant risk, we will be there to serve the state, because it will mean deploying a lot of doctors and nurses, and to be there to serve the state if ever there's a widespread case of infection. But as opposed to Dr. Saito, I really hope that we won't have any COVID-type risks that will hit us during the Paris Olympic Games. So we use a system called RACI, so a responsible, accountable, consulted, and informed. Well, unfortunately, you can't see what I'm referring to, but depending on the different people involved, they're going to be those who will be responsible, those who will just be informed, those who will be involved at the operational level, and those who will be consulted. Now, when it comes to the table, it's a lot simpler than what you've seen, but it really explains it really well. We're going to have sources of information, and like I said, the sources of information can come from the Games itself, the Olympic Committee, the CIO, or state services, and it will go through to the MEDOC, which is the Medical Operations Center, which will be active 24 hours a day as of the 1st of July. And the MEDOC will be collecting all types of signals, whether they be weak signals or strong signals, and who will be giving a daily report. The MEDOC includes the MOC, which is the main operations center, and that will be housed in the main building at the Paris 2024 Games. And within the MOC, there will be all the different functions, the SOC, that's the Security Operations Center, the Transport Operations Center, the TOC, and everything's going to be grouped together in order to provide for a rapid response at several levels if a problem occurs, no matter the type of problem. And so there will be an action that will be triggered. For the SOC, it's the Security Operations Center, but it could also be when it comes to HR, and so we have many acronyms. For Paris, the Paris 2024 Games, we have a ton of acronyms. Or the communications. Communications is once again going to be a key element, not only internally, but externally as well. I'm not going to go into details on all the measures that are listed on the right and what every party will do, but all of this has is the result of a lot of groundwork. But now what I'd like to look at is what can potentially happen with a heat wave. We have set thresholds that have been, so the threshold has been set at 32 degrees with humidity levels of 40 degrees. And so we have these thresholds, and every time we look to see what is affected, is it the buildings and the installations? Is it the people? Do we need to trigger our contingency plan? And in this contingency plan, which population grouping will be affected? Will it be the athletes, the public, the Olympic family, the workforce? And so we have different variants and different measures for each grouping. And there are levels that have been defined by the state and notably by Santé Publique France. And we will be following their recommendations. And this will lead to the activation of a certain number of contingency plans depending on the thresholds. And the objectives are very clear. It's to guarantee the safety and security of all those attending the games on site. It's to organize business continuity for the games. What's important for us is that all the sporting events can take place as planned. As well, we're going to keep things running as best as we possibly can, and excluding the exclusion areas. So we have also levels of severity that range from 1 to 5. 1 and 2 needs to be solved on site. And as of 3, 4 and 5, this has an impact on other things. So for example, here we have somebody who's unwell and is a level 3. At level 4, it's a large number of spectators and volunteers who have fallen ill. And at level 5, it's impossible to continue with the games. So this is coming back to the table I was showing you earlier. And here you can see that the information will come in via the security department or services that will flag and say, be careful, we have a lot of people that are unwell and that are fainting. This will go through to the MEDOC, who will then transfer the information to the MOC. And then this will then trigger a certain number of contingency plans and measures that will be taken in consequence. On the map here, we've identified the sites where we have risk areas. They're called ICUs. So we have identified these risk areas, urban risk areas, and those that are non-risk areas. And so we've got our indoor facilities. So it's not because you have an indoor competition that there isn't any risk for those who will be waiting in line before gaining access to the venue. And so for these sites, we have additional measures that have been put in place. For the spectators, as you can see here, you can see there's the features of the site. Are there any shady areas? Or what's the distance between when they get dropped off by public transport and their access to the site? Are there water fountains so people can drink? And are there any measures that are planned for this on site? So we've got the National Golf Course. We've got some external sites. We've got the road mass events, so those are for the marathons, the bicycle races, anything that takes place on the road. And there's the Invalides. The Invalides is where we're going to have the archery competition. It's out in the sun, and there are very few shady areas in the vicinity. And then we've got to focus on the risk for athletes. The International Federation has defined risks, so it was a bit easier. We just have to apply those rules. And if we are within scope, we can continue with the competition. But if we're out of scope, then the games have to end. But we won't have the same messages for the athletes as we do for the public. So we know that beach volley athletes, they are even able to play when it's 40 degrees outside. They're used to that. However, for the public, we will say that beyond 32 degrees, the public spectators need to take their precautions. They need to come in with a bottle of water, cover their heads. Not bring any fragile people along with them. So the different messages which might be difficult to understand. So these are the different case scenarios. And like I said, we've set threshold of 32 degrees, 40% of humidity, and we focus on the infrastructure, water supply to see if there's enough water on tap. And so the rule is to have one water tap per 300 spectators. And so this is something that you need to anticipate on cleaning as well, because if people come with the water bottles, there's going to be more waste. And we also need to make use of the facilities and sell things such as fans, have air conditioning, sell water bottles. And the red card is something that the delegations can hire or rent.
Il va falloir aussi.
So same thing here.
You need to work on CPR and first aid. We'll have many more first aid workers in these warm areas. We also have the shield zones for spectators, cooler areas for fragile people or those who are perhaps on the edge of heat stroke or not feeling well. There's also water that will be handed out very quickly if necessary. As all the tickets will be electronic, we'll have the holders' email addresses, so they'll be at the Santé Publique France, and the state agencies can push messages out to these folks regarding the zones that are at risk. So we can do this per zone, per location, per venue. If there's some special, especially risky areas, we won't send people in. If there's an external area saying we're going to have a very hot day, we'll send out push notices. Okay, so general countermeasures. For the clinics, the infirmaries, we want to have 6 degrees under the outside temperature for ICU and other, and have enough water, bottled water if necessary, and have additional rescue workers, first aid workers. We also have to protect them. So the more rescue workers, healthcare workers, first aid workers you have to make sure that they're okay. So the question isn't really knowing if we're going to have heat waves, it's really knowing how many we're going to have. So our contract with Météo France, French weather report, is for each location, each venue, we will have a meteorologist able to predict the climate within 1 to 2 hours. We also have a contract with Paris. So some more countermeasures. I talked about comfort. I talked about water. This is the same thing here. Next, we have per customer, sort of as it were, per population. We've got the athletes, and the locations will guarantee for them temperature of 25 degrees unless they're out external. And the heated areas or very warm areas will have -6 degrees compared to the other areas. We'll have fans, and there are eco-responsible buildings with the ability to keep this -6 degrees compared to outside, 6 degrees lower. And even if you have heat waves, even in the fall, for instance, we saw that the norms were complied with, even better than expected. So we have to have a supply of water, be able to provide first aid and rescue anytime and necessary. Now for athletes, especially for Paralympics, the Paralympics, we know that any people with special conditions, their body temperature regulation is a bit different. This may explode our carbon footprint, but we have air conditioners for these, and these will need to be spread out. And as regards to transportation as well, it's public transportation, and only a third of the buses will have air conditioning. The air-conditioned buses will be reserved for people who have a difficulty in achieving thermoregulation. Could be over T6 or perhaps multiple sclerosis participants. So we have special measures also for athletes for what we call the exertional heat stroke. This is getting overheating. It can be fatal. So we've defined this with the IOC, and depending on the data that we have, we'll be looking specifically at rugby, athletics, men's and women's marathon, walking, the mass marathon, where we'll have 24 people, and the triathlon and mountain bike. So this requires specific equipment. As you can see there, a thermometer with a sensor, because this is the only way to monitor the person's first aid administration. Okay, quickly, prevention plans for Paris 2024. So these are shared with the IOC and the IPC. And so So excessive screen usage and prevention of STD. So we're sharing the load here. So we know that athletes all use screens. They're all on their phones. We know that it impacts sleep, mental integrity. People can be aggressed, can be accosted. So we're working on that with podcasts, testimonials, videos, explaining how to make better use of their phones, and then sexually transmissible diseases. We know that they're still out there, so we'll be providing preventative measures, condoms, prophylactics, quickly. Now, as regards to screens, we'll have a campaign called Unlock Your Potential. And as I said, we'll have guides, posters, flyers to explain what excessive screen usage really means. We'll have videos. We'll have testimonials from athletes explaining how they've been assaulted and while on their screens and how they've improved. We tend to see that athletes who speak to athletes are more effective in their communication. So here quickly. Okay, and prophylactics, condoms here you can see. So 210,000 with 10,000 without latex for anyone. 20,000 with latex free for those who are allergic, and we'll have feminine and labial condoms as well. So we're trying to be a bit funny as regards our packaging. As you can see, put performance aside, listen to your partner. Fair play, safe play, consent first. So I think these are going to be collector's items. That's it. Thank you so much for listening.
Merci beaucoup, Dr. Levin.
Thank you very much, Dr. Levin, for your presentation. Very interesting to see the plans and the risks and risk mitigation. However, we don't have any time left for questions. Perhaps you could send those in afterwards, following, or maybe we'll have time after Dr. Céline Kellio-Sutherland's presentation. He's the Deputy Director of a Data Division. It's a Data Science Unit in Santé Publique France since 2022.
2022. Dr. Céline Cazerio-Schoenmann has coordinated the Sursaut syndromic surveillance system. And with that, I would like to give you the floor. The floor is yours.
Thank you very much. Hello, everyone. So I'm not a specialist in mass gatherings as my previous colleagues were, but I'll be speaking, as it were, sort of as a spokesperson for the Paris Olympic and Paralympics and the teams that have been working on the various aspects of preparation for the Olympic Games. No conflicts of interest. We've already talked a lot about the dates, and we're getting closer and closer to the Games. We have the regions that are going to be involved, and we have here in France, Tahiti for surfing, with the number of competitions in the greater Paris area, that's Ile-de-France, and the huge quantity of athletes, journalists, volunteers, countries, and tourists coming to attend the Games. So as preparing our surveillance for the Olympic and Paralympic Games, we started looking at what would we be doing, and would we be applying this to any and all mass gatherings that we will be needing to deal with in the future, and if so, which ones? So we asked the question and did some thinking about what a mass gathering is and when we should apply a special surveillance. So this is defined by the number of people. So your surveillance, the definition of mass gatherings has changed over time. Of course, it started out by being the number of people beyond which you would consider mass or big, right? And then, first of all, it was big. And then they were defined based on the goal or the objective, as if it's sporting or sports or cultural or political, in a specific area with different degrees. In the 90s, you can see the definition here, top left, Norberg, Mears and Batson. They exposed the fact that it wasn't really about a place, a specific place, but it could also be on something more moving. It could be such as people on a plane or people in a subway. And we needed to determine whether it was what medical care would be needed to treat all these people gathered in the same place. So this has changed then, and we've moved towards the necessity of including early medical intervention to deal with any occurrences in these gatherings. As you can see, 2007, the Arbonne definition. So mass gatherings then were extended to a risk of a delay in response to emergency and limited care to the patients due to this, and which would require planning and preparation to limit the risks or mitigate the risks. So we're gradually moving towards this definition of mass gatherings to get to the WHO definition that Marie gave you earlier, which includes medical intervention, but also an international context and the country, the state preparation hosting the event. Okay, we said that's all fine and good, but from an operational standpoint, what do we need? What definitions do we need at Santé Publique France to know when we need to implement higher surveillance and a special plan? So we said that this could also depend on the various issues at stake that the gathering would entail based on the characteristics of the issues. If we look at Paris Games and Paralympic Games, so we add to the list. So this identifies a concentration of a large number of people in a same place at the same time, which impacts the spread, or which could bring about the spread of diseases and the lack of perhaps care in the territory. And then the diseases that hadn't been present yet. And then the implementation of temporary housing structures or restaurants and food that could be temporary and precarious and could promote in collective food poisoning. So we said this yesterday in the session on adapting in these mass gatherings in face of climate change. So these tend to be in the summer where national championships are completed. So we end up confronting environmental risks, as Mr. Levin mentioned that, what Paris 2024 is doing regarding heat waves. We also need to manage population mobility, diversity of languages that can also could cause difficulties in preventing control measures, and documentation of what we're offering can perhaps not be read, and having to adapt that in foreign languages, potential occurrence of malicious actions, terrorism, typical terrorism, traditional terrorism that we've had in France, in Paris in 2015, and Nice in 2016, or actions regarding biological, chemical, nuclear, radiological systems. So people likely to seek care, which could lead to saturation of care facilities and shortage of certain drugs in the pharmacy. So this said we needed a more operational definition as compared to what we would normally be doing in just a mass gathering, and extending this to something more special for the Olympics. So this is some long-standing experience since the Olympics in 2006. My personal experience goes back. Probably started before, but I couldn't find any references prior to this. And various other events, sporting events, located in, say, for instance, the World Equestrian Games in Normandy. It's multi-centric. The cricket and the Rugby Cricket World Cup in the French West Indies. the Rugby World Cup 2016, a joint publication with the UK on joint surveillance that we implemented during the World Rugby Cup and the Euro 2016, sorry, and the Rugby World Cup enabled us to trial out some of our new procedures that we are going to implement for the Olympic Games, cultural events. The Armada from Rouen 2023 edition was a good test for us to prepare for the Olympic Games, and then geopolitical events or historical commemorations, like the anniversary of the Normandy landings. You can see that a lot of examples in Normandy. That's an area where Santé Publique France has a lot of experience. So COP21, or the G7 summit in Deauville and Biarritz. So we have legacy from those events. We realized that we needed to multi-source across all of the areas and not leave any blind spots. We needed heightened surveillance across the board. We need responsive data, enabling us to have a daily update of information. There's short lead times where we have to communicate very quickly. We also tested event-related emergency care. I'll be talking more about that in a moment in the following slides. And then the benefits of monitoring from a predictive rescue systems. Okay, what is the agency's role? What are our missions in mass gatherings? Well, of course, we need to implement and reinforce epidemiological surveillance, but also strengthen our prevention tools and communication, working with the other operators. We saw this in the previous presentations. We need to size the pharmaceutical establishment's resources. This is part of Santé Publique France's mission as well. So now the resources to carry out these missions, of course, it's ensuring HR continuity. We need to organize and reorganize based on the event, specifically in the summer, which is a time when there's heightened activity due to the various risks, but also a lot of colleagues tend to want to take vacation, take holiday leave. So that's a crucial point in preparing for this type of event. Another crucial point here is securing information systems, especially through BCPs or business continuity plans to head off any risk. We have to anticipate those risks and have backup systems ahead of time. And then we have to adapt our communication strategy. So all this, as our colleagues have mentioned already, be it in London or Tokyo, this requires years of preparation. And the methodology is, first of all, you have to identify the risk. So that's we have a risk map that was carried out with the Ministry of Health based on the documentation review, literature review. And I know we have people out here who in the room with us who are involved in this. And so risk mapping, weighted by probability of occurrence and the severity. So this basis enabled us to identify the main risks for Paris 2024 Olympic Games. We talked about this. Philippe Leven talked a lot about this. Their environmental risk, a lot of heat wave, and because every year we have heat waves that impact a lot of France, especially the Greater Paris region. We have infectious diseases, and some that do not require urgent action. They can be, we talked about collective food poisoning. This can be environmentally related. Arbovirosis, you know that the vector Laetus albopicus is in pretty much all of the counties, the departments in France, not necessarily all towns though. Leptospirose, related to swimming activities, keeping in mind that the triathlon activities will take place in the Seine. Legionellosa, with these risks for everything that requires cooling food. So those are the infectious diseases. So continuing with the infectious diseases related to health and food. You know that we have mumps and measles coming back. We have whooping cough, and that's bringing us to revamp our risk map, because there's some risks that will likely increase with whooping cough, and then finally any trauma, any This is quasi-systematic, very high frequency, but low severity, typically speaking.
On a élaboré une... So for each type of risk, we've come up with a mapping for our monitoring systems, and we've prepared the protocols as well as the preventive measures that need to be enhanced in the event of a risk. And now, when it comes to the strengthening of our health monitoring and surveillance, what do we do in terms of surveillance and monitoring? We do what we already know how to do. So what that means is that we continue with our routine monitoring, but we enhance that. And the objectives are to have early detection and warning so that we can implement management measures as quickly as possible. We rapidly assess the impact of an event. We need to describe it in terms of time, place, and the people impacted. And we especially need to be able to reassure, and that's what Tina and Tomoya said. In the absence of impact, we need to reassure the public that there's nothing happening, and so it's very important to reassure when there's nothing happening so we can identify when something happens. And decision making is very important. And the last objective is also, in addition to early detection and warning, is to be able to provide figures for information purposes when there are any healthcare events that happen in the framework of the Games. The strategy is to use the existing functional systems and strengthen them to raise network awareness and also increase the number of indicators, add any additional indicators to those that already exist, develop new monitoring systems. And so take advantage of the Olympic Games as an opportunity to introduce new systems which on the basis of assessment can be used thereafter. So that's part of the Games legacy. Strengthen collaborations and, of course, have nuanced reinforcement according to the regions concerned and the type of period in question. And so here are the 6 pillars of our surveillance system that will be strengthened during the Games. So on the left, you've got biological monitoring. So that's per pathogen based on laboratory data and the National Reference Centers. We have 43 of those. The voluntary network of labs, and the labs will centralize their data. We have 2 centralizing, which is BMNI and SERBA. And the last part of it is the surveillance of wastewater. So we have 54 water treatment plants throughout France. And so that's as far as our biological monitoring goes. Then we've got specific monitoring. So that's for diseases. And they will make use of data that are declared. And our sentinel networks as well. And then in the middle, we've got our non-specific monitoring with the system that we have for monitoring emergencies and mortality rates. This is a system that we've had for many years, and we celebrated the 1000th bulletin. And it includes 4 sources of data. The data from the emergency services, any medical acts carried out by associations at SOS Médecins, all types of mortality, and any information to send through to the INSEE, as well as the electronic death certificates. So these are systems that are up and running the whole year round. And alongside that, we'll be testing 3 new systems based on the first responders. That's the ambulance and the firefighting services, as well as any other rescue services in conjunction with the Games and outside of the Games. And the 4th pillar is environmental surveillance. And this is a system that's instituted every year between the 1st of June and the 30th of September. On the 50th of September for the health and heat alert system, this is based on healthcare indicators, as well as drowning surveillance, which is based on indicators which comes from our ER facilities and comes from the National Nautical Activity Surveillance System. And then there's also infections that are linked to our infection protection systems, the CPS, and International Watch with the help of the CDC. And all of this will help us to reassure. So all the systems that are surrounded by dotted lines are existing systems that are going to be strengthened. The green ones are the ones that are going to be tested, and the ones surrounded by the green blocks are the ones that we will be using for the summer. And examples of reinforcement will be raising awareness of key risks amongst professionals. And so it's very important to declare any suspect deaths or any events without delay. And there's a certain number of mandatory declarations. If we think of the arbovirus, for example, this is a risk that is a big worry for the Olympic Games. When people come back from a trip, we need to start testing from the very first symptoms, and we need to notify it as soon as possible if there are any probable cases or confirmed cases, and then make the appropriate declaration. So we absolutely have to alert and make all the mandatory declarations as soon as possible, so that we can institute the management procedures and prevent the development of clusters. In terms of syndromic surveillance, we've spoken about our experience with labeling. What do we mean by labeling? And so this means providing for care and treatment linked to an event in order to make a distinction. This is the cases where the population carries on consulting, even if it's outside of the context of the Olympic Games. And what was asked from our network, we worked on a definition with various parties, and we asked for the clinical data to be coded and to use a specific code to link the incident up to the Olympic Games. And so here we have an example of the form that will be used in the different emergency services, and the code that will be Y339. And we'll be doing the same thing for SOS Médecins. So a lot of groundwork that's been done with clinical specialists and our network partners in order to raise awareness as to the required approach through our steering committees, as well as various webinars that we organized and participated in. Another example of a collaboration and exchanges with the Epidemiological Society for the Army Health Service for the sharing of risks, monitoring systems and indicators. We said that we would have discussions with them upstream of the game. We're doing that already, and several times a week during the games, in order to share on our analysis of any signals of interest. And of course, there will be exchanges with the UK HSA and Japan. They helped us to work on our protocol, and also we are meeting here today in order to share the stakes and the challenges and benefit from each other's feedback. As regards new systems in the pipeline, there's the International Watch, and our agency any agency that doesn't have an international watch will be helped by the CDC, who will monitor any epidemic intelligence activities from the 15th of July through to the 13th of September. And as far as opportunities go, we also developed collaborations with the emergency services, with the ambulance services, whereby we'll be able to analyze data on call volumes through to the ambulance services. We have 40 services that are participating in the system, but we'll be joined by another 2 before the start of the game. So we'll have 42 in total. That will be a first source. And then there will be also the patients dealt with through the crisis management portal, and we'll look at all that relates to their diagnoses. And then there are the emergency services with the for the competition sites and the training sites and festive sites throughout France, as well as throughout the Île-de-France region. We'll be working with the civil security societies, the Red Cross, and the French Federation, Search and Rescue Federation. And we'll also be working with the Paris Fire Departments, who will be sending through data for certain clinical panels, and which will be the same ones as we use in our analysis with the ambulance services. And so all this data will be analyzed and will help us to carry out our daily surveillance and monitoring. And we'll also be running tests on the use of mobile phone data. So the number of people that will connect to geographically positioned terminals, and we'll make a distinction between residents and frequent visitors and tourists, and that will enable us to vary and differentiate the source of the different indicators. In terms of feedback, this period will be from the 8th of July to the 15th of September, and the daily reporting and restitution period will go from the 15th of July to the 8th of August, and then from the 21st of August to 9th September, with daily feedback sessions and daily report backs, both at national and regional level, for the health authorities and a number of partners within the Île-de-France region. And there'll be weekly bulletin reports that will be translated in English and will be published on our agency website. And the aim is to provide a summary of alerts, an epidemic analysis of our indicators, and all the points of surveillance at the regional scale. And the bulletin will also be used to give a report back in terms of events that happened over the last week. When it comes to prevention, we stepped up on our pre-existing systems, but it was also an opportunity for us to introduce new tools and additional systems on the basis of three main themes. So risk mapping, heat waves. We worked in strict collaboration with Philippe Levin's teams from Paris 2024 in order to adapt our messages, and then arbovirus and measles vaccinations, with messages for healthcare professionals and for the greater public. And there will also be a creation of a theme document, which will be available on the agency website. And so all of this will be accompanied by the preparation of a communication plan with a dedicated page on the website and a visual identity of everything that's been done within the framework of the Games. On the basis of our experience with COVID 2019, we work on communication, educating people in terms of what we do within the agency, and a lot of work done on literacy so that people can understand what the agency produces. When it comes to the post-Olympic legacy, Tina and Tomoya put a lot of emphasis on the importance of this post-Olympic legacy. And of course, this would entail the publication of scientific reports, feedback in order to identify places where improvements are needed, and to carry out an assessment in terms of what was done upstream and downstream of the event, as well as future prospects and how the Games served as an opportunity to develop new systems, something which needs to be assessed to see whether the systems have been efficient. Did they meet their objectives? What were the resources used to develop them and to introduce them? And so we hope that we'll be able to extend on this approach, an approach that was initiated with our preliminary collaborations. I'd like to thank all those who contributed to this presentation: Arnaud Tarantola, Sandrine, and when it comes to prevention and the stakes and challenges, Arnaud Mathieu, and all the different healthcare professionals, and all those that are partners of our network. Thank you very much for your attention.
Thank you very much to everyone for coming here to the roundtable. So we have two more guests that we haven't presented yet. So I will start by presenting Sophie Chaumian, who is a jurist specializing in health law. So within the institution, her position she used to have a position as the legal division and later as the subdirectorate for surveillance and health security, where she served as a mission support officer to the deputy director. Since the establishment of the Center for Health Crisis within the Directorate General of Health, the DGS, in March 2024. And Sophie Chaumian has been the deputy director for crisis preparedness, and since November 2021, she has overseen the preparation for responding to exceptional health situations during the Olympic Games. Thank you very much for joining us. And the other guest I would like to present you is Dr. Arnaud Tarantola, who is from the ARS of Île-de-France, at the Santé Publique France in the IRS. Apologies for that. So yes, without further ado, maybe then we can start. Apologies for that. And yes, over to Marie.
No worries, that's a common mistake. But first, to start the roundtable, please feel free to ask questions on the tablet if you're online. in the room as well. But maybe to start and welcome the two guests, I might have a question for Sophie Chaumien. So Sophie, je vais m'adresser à vous en français.
Sophie, what we've understood through these presentations from Thomas Saito and Tina Hendricks, as well as all the other presentations, what we've understood is that there are many partnerships, and of course there's the involvement of the healthcare ministry. And so what type of preparatory steps were taken at the ministry level? How can we ensure that there's continuity in terms of surveillance, and especially during the time of the Olympic Games? So the General Directorate for Health and the Sub-Directorate that I represent was in charge of preparing the health system for exceptional health situations during the Olympic Games. The work started 2 years ago, and it's under the auspices of the General Secretary of the Healthcare Ministry, and who himself works in an interministerial context. So the first thing that we did when we started working on preparing for the Olympic Games is that we set about to understand the new ecosystem and our position in that ecosystem with a new contact, which is the CIO, as well as what would happen within the context of the Olympic Games, and our responsibilities, as well as the responsibility of the state. So it's all about working interministerially, because the organization of the Games falls under the Prime Minister and the interministerial delegation that we had to meet with. And so the General Directorate for Health had to prepare by enhancing the healthcare system. And we focused on three main pillars, pillars that were mentioned by our different speakers. And so the first thing that we worked on, what was essential to kick off with the works, is we needed to identify and have a handle on risks and threats in order to be able to face any exceptional health circumstances. And so within that framework, my sub-directorate started with a global risk analysis. We looked at the threats and the risks that could possibly disturb or unsettle the healthcare system. And this is something that you mentioned in a part of the work that you did. We carried out this work in collaboration with the ANSES and the regional health agency of the Île-de-France, who was particularly involved in the preparation of the Games.
So from this context, analyzing risks became a focal point. So working with our partners and the agencies, we worked to enhance the surveillance system and the actions to set up for mitigation wherever necessary. All this was done, of course, working with Paris 2024, because the goals of our work, as you were saying, is to ensure continuity. So all the alert signals and everything that could represent a serious situation, severe situation, needed to be detected as early as possible by the Paris 2024 cells, and it has to follow the ad hoc system, has to be escalated to the necessary. There's some existing systems that have been enhanced or reinforced to make sure that healthcare authorities, the ARS, Agence Régionale de Santé, Regional Health Agency, and Greater Paris, make sure that in charge of surveillance, so that they can react as fast as possible to shut down any threat. So that was our initial work to ensure continuity and reinforce our preparedness. The National Health Directorate carried out works to reinforce our planning. So it's the ARSAN system set up in the regions to enhance, prepare any treatment should there be victims, and we've also consolidated and reinforced our resources, as we heard earlier about the strategic stock of medication. The Santé Publique Français, SPF, and government as well. So we've had preparedness, readiness exercises. Our agents are prepared, and we have the operational center for responding to health emergencies from the health ministry. So we've got training, exercises carried out with P24, organized by the ministry, as well to just be especially ready and to be able to react and respond to crisis alerts and to be able to act and react quickly. Also to be able to analyze indicators and signals that are sent to us every day by Santé Publique France and the healthcare, the regional agencies, and the close working relations we have with MEDOC. So we're all working hard to ensure this continuity and the partnerships with the teams, and so everything is going as planned. Now, I believe my colleague has a question. Yes, a question for you, Mr. Arnaud Tolatala.
Epidemiology unit for Paris and the neighboring departments, as a clarification. And also, so coming then to that one, 90% of the events are taking place in the greater region of Paris. What were the specific challenges or preparations or even opportunities that you have for the specific region?
Thank you, and I don't mind the initial, not mistake, but it does reflect our very nature, which is that Santé Publique France and the ARS are basically, I'm in shared custody, basically, en garde partagée in French. Obviously, my hierarchy, and I belong to Santé Publique France, but my daily interactions are, I'm embedded in ARS, so obviously they're my natural partners. And being between the two is sometimes being a little bit like Scylla and Charybdis in Greece, I believe, and or having sometimes to be between what we call in French le marteau et l'enclume. It can be a little bit challenging, and sometimes the path is quite a narrow one. So that's certainly a challenge. The other challenge, obviously, is staffing. Our team has 8 full-time epidemiologists, well, not even full-time, 8 epidemiologists, some of which are part-time, and for a population of 12.3 million people. So obviously we have to choose our fights, as we say, and be quite quick on our toes, quite light on our toes to be able to choose the fights that we actually pick. The challenges that we faced is probably managing the breathing space to be able to identify local needs, if you will, or at least needs that make sense in the field, and to identify these needs, propose and work on specific surveillance systems. You were mentioning Brigade de Sapeurs-Pompiers de Paris, which is the French firefighting units. Les dispositifs prévisionnels de secours, which are again the first line responders, the first aid providers, whether within the stadium or just outside the stadium. This was a proposal from the Cellule Régionale Île-de-France, which we worked upon, and we tested it with Armada de Rouen, and it worked very well, and that's why we decided to extend it. And I'm very happy to say that the contacts, which initially were quite difficult, and I thank Loïc Gross for having helped us get the contacts that we needed to extend this, but it was certainly a joint effort, but the idea initially came from the field. You were mentioning Yves Gallien, who was a medical resident, or public health resident in our unit in 2021. So he worked on that review of risks, which was then formed the basis for identifying risks. We worked in the emergency room to see whether the coding was adapted, et cetera, et cetera. So there are many things that come from the field which respond to very pragmatic, very operational needs. And to be able to bring that to the national level can sometimes be a challenge. To bring that to even beyond to the health authorities can be very challenging as well, because they don't always perceive what the need could be. So in short, to the strategy to be able to deal with that, and I don't have any commercial interests with them. As you can see, I'm not very athletic, but there's an athletic company that says just do it. So basically what you should do is you just do it. And if it works, it'll find its way through. And if it doesn't, you'll just take the blame and it's okay.
Thank you, Arnaud, for the view on the preparation of the region around Paris. Est-ce qu'il y a peut-être des questions en salle? On peut vous apporter un...
Any questions out here in the room? We'll bring you a microphone. Please hold for the microphone. Thank you. Can I ask anyone I want on any subject? Absolutely. These 6 people are here to answer your questions. I just needed to know if I had to go with the ARSs or... No, it's for Mr. Philippe Levan. I realized that you have quite an extensive experience in the Olympic ecosystem. And I was just wondering, I didn't realize how involved you were in the various Olympic Games, but my question is, we see that it's quite a machine that's, quite a well-oiled machine that's proven itself over time. But my question is, do you have contingency plans in your Olympic system, or is there in the Olympic system a plan when the Olympics come to a new host country? Is there a procedure, such as making contact with the health authorities of the host country, but even beyond that? You see here in France, it's a bit specific. You get surveillance, you've got management, and you have Santé Publique France. Is there a plan where you roll out the various contact points and people you get in touch with, or Santé Publique France, or how you manage getting to this fluid, fast, efficient communication circuit? Well, we're lucky to have a good documentary base called the IOC, and they were they're behind the organization of the previous games. So we have a whole host of documents with policies and procedures that have been written, described, and it's up to us then to adapt those to our local context. For instance, in all the English-speaking countries, you have paramedics, and these are completely different from our rescue workers here, so we have to adapt and adjust the rules, but we have plans regarding temperature, diseases, illnesses, what we need to do. So it's a guide, but we do need to adapt it to each country because they're different government agencies. And the most important is what you were saying at the DGS. It's really communication and coordination. That's why we've carried out lots of exercises over the past few months. We call those games where we play norovirus or a terrorist attack, or they're games-wide simulations is what they're called. So we make sure that we have efficient communication channels. First of all, I forgot to tell you who I am. I'm François from Santé Publique France. I wanted to more specifically, due to a personal bias, I wanted to talk more specifically about surveillance. Ardon, I see he's not very happy, and I work, I'm kind of grumpy as well, because all these exercises are a bit unfortunate because we weren't included. Norovirus, for instance, I've never heard of that. I've never heard of the exercises at Santé Publique France. So I guess that's my question. Like, it was a bit kind of annotated, orientated. So these connections and the communication, is it through the DGS, the General Health Inspectorate? Well, in the way of an answer, as I said, it's DJOB, it's the OCOG, it's the Interministerial Governing Agency for the Olympics and Paralympics. So they give us our point people or contact people. The IOC is going to be in touch with Santé Publique France or with DGS, and we are sort of in the middle of all of that. We are familiar with the agency, so then we kind of orientate based on what's requested of us. Novovirus is, this happened at the Pyeongchang Games. So the IOC has experience with that, and we just use that as one of our exercises. Okay, well, thank you very much. And we're really counting on you, and 20, we're counting on you as well. It's totally mutual. We'll be there. We'll be on board. So our information channel is going to be the software with the consultation with the medical appointments. This will enable us to see if we have these like TIAC food poisoning cases for if we need to issue an alert, all the signals coming from Greater Paris region, Ile-de-France, or even across the world, because we'll have tourists coming from many different countries. And we need to have particular vigilance should there be some new Ebola coming into the country. Thank you very much, Philippe, for your answer. And thank you for the questions there. Now, regarding exercises, this was Madame Hendricks mentioned that in her presentation. That's at several different levels: exercising, testing, trialing out solutions for crises, and reproducing things that will be happening over the summer. So now we have a question coming in from on the tablet here from the internet, and it's for Madame Chomien, and looking at the definition of these mass gatherings in the presentation in the beginning of Céline Cazerieux, her presentation, is it planned to include indicators on the functioning, say, saturation of the healthcare system, difficulties in access to doctors and or pharmacies and medication? Anyone, would you like to take that question? Either of you? I think it would be DGS. The General Directorate of Health Services. So what we saw earlier, the indicators that will be escalated, existing indicators that escalate during each event or weekly. This has been reinforced by Santé Publique France as well, and we heard that earlier. There are also indicators coming from the ARS, the regional health agencies, but any and all indicators that send up strong or weak signals that may impact the games. In fact, we're interested in indicators on emergency room visits and the reasons, also reasons for hospitalization or taking our or health management. So those indicators. And then the code was mentioned. What the issue really is the idea is to have a visibility, have exhaustive view over everything, to be able to track the event and report that to our authorities. Let me add to that the types of indicators that we are producing and we're watching. In Santé Publique France, we are orientated on mostly pathologies, diseases. So what we provide are indicators that will orientate towards tracking a given type of pathology, not necessarily directly. See the occupancy rate of beds in hospitals, or more, I would say the national local health agencies, and then directly and indirectly our indicators are some people requiring care. It can be ER, it can be SOS médecins, SOS doctors, giving us indications. We'll analyze all of those, and looking at the level of care needed, this in fact could give us an idea. Should we focus on, say, the number of hospitalizations and what types of hospitalization, and the how that can weigh on the hospital system? But this won't necessarily give us an idea of the capacity of the system to absorb this higher patient load for a mass gathering that could be a vector for and could bring about the saturation of the healthcare system. Okay, question there in the room. Mike, please. I have a more general public question. I'm from scientific research. I'm at the Pasteur Institute at INSERM. And in terms of prevention, I'm wondering how you assess prevention, communication. What are we doing as regards to the general public coming to be a part of these mass gatherings? Because personally, I haven't seen anything. You talked about prevention in your presentation, but I'm just wondering, okay, it was on mumps, measles, but I didn't see a lot of I haven't seen a lot of communication on that. And I've been tracking that as a topic in general. I'm just wondering how you determine what type of information gets out there without really submerging the general public with too much information that wouldn't necessarily cause panic, but with the media maybe making it digestible, but not just information overload. I'm stumped on that. I'm not a specialist in prevention. I know there are prevention colleagues out there. How do we adapt, and where do we stand, and how do we find the right happy medium between too much information, and which could be anxiety inducing, and not enough information where we miss the target? So there are prevention actions. They have been enhanced in the 3 main risks in the risk map, where we had identified a need for new assistance, sometimes new media, heat wave, mumps and measles and arbovirus. And we needed a more comprehensive kit for foreign tourists, for instance, so they get that information ahead of time. I know that there are brochures available in a paper format and electronic format. We need to use innovative tools for all ages, all audiences, all people. Maybe some older people who may not have access to electronic information, but the right dose, maybe I can come back to you afterwards to see if afterwards we find a way to adapt these processes to strike the right balance. I would like to have your phone number or your contact details, and I can give you an answer to that afterwards. Thank you so much, Céline.
Professionnelle cette réponse.
Does anybody have any other questions from our audience? So thank you very much. I work for the Pasteur Institute. I have a question for Mr. Levan. When it comes to the Seine River, because we didn't mention it and somebody had to raise it at some point. And so I wanted to know, what do you think, given your current position and bearing in mind that the Austerlitz Basin was commissioned recently? And do you have any data on that you can share in terms of whether the situation has improved in general or not? And what is your opinion on that? So like I've often said, because very often I get asked that question, so the swimmability of the Seine River for 2024, we didn't say that it needed to be swimmable, but it needed to be swimmable for 2 hours. So just enough time for the competition to take place. And so that's already an easier challenge to take on. And at the moment, you might have noticed, for those of you who live here, that we've had quite a lot of rain. And so the flow of the Seine is out of the ordinary. There's 400 cubic meters flowing per hour. And so that's unusual. And usually it should have been around 150 to 170 cubic meters. And so during the summer, we know that it should be at around 120. And so there's an exceptional phenomenon. There's the pollution that's coming from the top. And because the rain drains everything out of the sewage systems, and it all lands in the Seine River. And so the second thing is the Austerlitz Basin. And this basin is 50 meters deep and it's 30 meters wide. So I think it's the size of 25 Olympic swimming pools. And so if ever there's upstream pollution, it will enable us to stock the water for the time of the competition. So there are 3 water purification plants that have opened. So you need to see with the DREADs because they're the ones that are the specialists. But we're waiting for the measurements to come in. At the moment, the measurements are not good, especially for the E. coli. For the other indicators, we're on track, but we'll see with time. But quite honestly, we need, if Annie Hidalgo, the mayor of Paris, she wants to swim, that's all and well, but we just need it for 2 hours of competition 4 times over. So we've got the men and women's triathlon, we've got the mixed triathlon, we've got the open swimming, which is 20 kilometers swum in the Seine, and then the Paralympics and the triathlon linked to that.
The next question is more about something that was presented by you on the unknown, because preparing for known diseases, there is a plan, and there is we've seen it already, how these plans and the contingency is targeted. I'm very curious to know more about the outcomes of this new novel surveillance on unknown syndromes in ICUs. If you could further elaborate on that.
Thank you so much. So this type of surveillance is one of the concern in developed countries who have a certain level of surveillance. The final question is always how we can detect early of the unknown illness. So we installed the new system and operated during the from 1 year before the event. And we had the G20 and also Rugby World Cup, and we tested that system. But during that point, we didn't have a report through that surveillance. Even now, we only have 3 or 4 times a year. That is very limited. But so we always discuss that type of how we can elevate the level of the awareness during the event. So maybe the medical doctors or medical institutions are key stakeholders, and we have to raise awareness and say and ask, see something and say something. And so, and also on the other side, especially in the people who accept the report or alert from the medical institute, their attitude is very important. So please welcome that type of alerting or reporting and warmly and respond appropriately and keep the trust with those people who volunteer to report something. That is very important.
Anyone else would like to say something about the unknown disease and the unknown syndromes?
Thank you. So we also put in a system for 2012 on the undiagnosed serious infectious illness. It was really to pick up something that could have been a deliberate release, so people presenting at hospitals and not being able to be diagnosed. It didn't pick up anything, and we did stop doing it, but would have been useful if we had kept it within the system. But because there was no reporting going on, it's difficult to justify the cost. But it did raise awareness, so we did a lot of training with medical teams about, if you are suspecting there's something unusual, there's a process here, and there's a phone number at the end of it to discuss with a very, very good expert about what you're seeing, what your symptoms are, to kind of like talk through that process and what you might need to be doing. So it is useful, but it needs to be used really to demonstrate that it's useful.
Perhaps just to say, there is a scheme for surveilling, monitoring severe respiratory illness, especially in intensive care units throughout France. Le système des infections sévères respiratoires, respiratory system, that would probably pick up a respiratory pathogen. It doesn't work in Île-de-France. However, what we do have are what we call établissements de santé de référence, meaning reference infectious diseases hospital, like the infectious disease hospital would be in London. I mean, something that where you know that the severe infectious diseases cases would be sent to anyway. So not much of a surveillance, but at least a very good event-based surveillance, because we have a very strong link with them. And should a case of severe infection occur, whether digestive, hemorrhagic, respiratory, or any of the above, you know that they will see an infectious disease specialist very quickly, a rather competent one, and that we have very strong ties with them. However, there won't be any zero reporting, etc. I mean, it's not really a surveillance scheme. It's more like an event-based surveillance scheme.
Peut-être pour compléter par rapport à ce que Tomoya.
And I'd like to add to what Tomoya and Arno and Tina said. I think it really depends on trust a lot. And it's about instituting trust with the partners that are part of your network. And it's a long-haul effort. It's something that you have to keep up. You have to keep it ongoing all the time. So when the time comes, it can work. And in Santé Publique France, we have regular meetings. And we have steering committees, and we have special ties that are maintained at the regional level and at the national level that it worked really well during the COVID-19 pandemic. During the pandemic, there was a lot of meetings, weekly meetings and exchanges with our network partners to tell them what was happening with the surveillance, to get feedback from the field, and to be able to have discussions with healthcare professionals, not only on the basis of clinical presentations. We went into the terrain of the unexpected when there was any specific diagnosis, things that could evolve and change with the various variants. And also in terms of our healthcare organization, there was data that came out of that enabled us to correctly interpret our indicators. So it's about keeping your networks alive and kicking. And it's a lot about trust and having feedback. And that's how you keep up the culture of alerts and notification. That enables us to capture any unexpected events and that aren't necessarily picked up by our surveillance system straight away. So thank you very much for those answers to that question. I don't know if we have any further questions from the audience. I have one that comes to mind. And I think several of our speakers today said communication is key. It's very important when it comes to preparing the Olympic Games. And so we spoke about working with our network of partners and being able to reassure the political decision makers even when there's nothing happening. And the Olympic Games gets a lot of media coverage. I don't want to say we're in the eye of the cyclone, but all eyes are on us during the summer. And so I was wondering about Tina, Endrix, and Tommaso. What were your experiences?
Media to the Olympics regarding surveillance, health, and to reassure them that everything is in place. And how did you report to them, maybe regularly or not?
I'll start and then Tomoya can take over. We did a lot of work with our media and with amazing communications team about putting out the messages about what we were doing. We did that press conference beforehand, which allayed a lot of the challenges and questions that we were getting about how will we know what's going on, what will happen. And kind of using our normal media channels because they're trusted, they've got that established relationship with media colleagues, and making sure we've got a credible spokesperson talking about it. So it was about doing what we already do, but doing it better. There will always be the unexpected that will come at you. But actually, most of the time, I gave a couple of examples, but they got managed down very quickly because actually we responded very quickly. We had some pre-agreed lines across all the partners for things that are likely to happen, like a norovirus or if there was a measles or something, pre-agreed so that statement could out really quickly. So there was no room for conjecture and confusion in the system. So it is always tricky. I will say you are going into the most worrying period because this is where everybody wants a good story. When the games are going, everybody gets caught up in the event and the kind of like games and the athletes and that. So it is now whether you say there's a slightly increased risk you might get some interesting media challenges.
So actually, in our event, as you know, the infectious disease is one of kind of a very sensitive issue. So that type of question were handled in a more high level. Actually, we did not respond directly in the National Institute. But it's always important to give information in a timely manner. NIID published the surveillance during the Olympic Games right after the closing ceremony. And that was very effective, I believe. And also, we have to be careful about the types of the journalists. You know, usually you will talk with the public journalists who are interested in or who are very knowledgeable on the public health, usually. But in this type of event, many types of journalists, sports or politics. So you have to be very careful about not using a technical words or understandable manner, communicate understandable manner. It's very important.
What Tomaya and yourself must understand is that our press has changed over the years in the sense that we used to have specialized journalists, and we very much do not anymore, in the sense that I'm old enough to have witnessed the emergence of the H1N1 pandemic, and when we switched case definitions, for example, and our numbers went down instead of up all of a sudden, we just had to explain it to a couple of journalists and everything went smoothly. Now we would have 20,000 hits on X Twitter saying, you know, we're lying. And in 2009, I spent time trying to write dispatches or contributing to writing dispatches to inform the public. Now I have to contribute to write things to fight against disinformation. And it's really not the same strategy. So, and to me, I think the lesson is that it's going to be a lose-lose game no matter what you do. So you probably want to do the right thing. I'm talking about, for example, from Mpox. I don't have experience with the Olympics yet, of course. But with Mpox, we saw it quite clearly. You try to do the right thing, and if it doesn't pan out, it just doesn't pan out. And the health authorities, local, national, have to accept that there will be 20,000 Twitter messages saying that we're being lied to. That's okay, it's just a part of life now. It didn't used to be, but now it's just a part of life. So we have to live with it.
Just, echoing my comment from earlier, the world was so different in 2012, and we were very lucky we didn't have that. But when we did what we did do is use some of the sports people as spokespeople, because strangely enough, people will listen to them more than they will the health experts. You know, use the kind of like work formats and people that you can do that are going to resonate in that kind of forum. So find some champions.
Non, simplement dire que les interviews, ça prend aussi du temps.
So it does take time. So there's so much things that we need to do between two different meetings. And very often it's the journalists who direct and say the interview is going to be at such and such a time. Everything goes today via the communications departments today. They're the ones, we can talk about the different jargon to be used. Like you said, it's very important to use certain terminology. We can't be spontaneous anymore because we know that it leaves room for misinterpretations. In any event, we're going to have haters. They're going to publish whatever they want. They will interpret the interview in the way that they want. And so it's become less spontaneous, but it's compulsory now. So thank you very much for those answers. Maybe we can take one last question from the room. I think you're the only one who wants to ask a question. So thank you. And I'm going to take advantage of the opportunity. It's a privilege. I have a question for Tina, and my apologies, Tomoya. I knew I wasn't going to say it properly, so that's why just my apologies, Tomoya. And with your experience and with the hindsight that you have today, this is something we discussed a little bit yesterday afternoon, but I wanted everybody to be privy to this information. If there was one thing that you could have done differently, what would that be? For both London and Tokyo, what would that be?
Okay. So I never say we are perfect, but we did the best. It's true. But one of the lessons as a scientist, we did not have secured enough time for the after-action review in advance. So we are very busy every day for preparation and response, but we should have been installed the plan for the inter-action review and after-action review in our response plan in advance. Otherwise, you will lose the memories and histories or the knowledge or experiences. So, for example, just fix the time and fix the participants and do the do the whole review in one day or something, just after the closure, 1 week after the closing ceremony, or something like that. Please fix it in advance and do it.
Mine's going to be along similar lines. We didn't have time to do it before. Well, kind of knew we had to do it, but didn't get around to doing it because there's too many other things going on. But so, as I said, I wrote our kind of like after-action review legacy plan between the Olympics and Paralympics. We had so much goodwill. It actually worked really well, but we'd have got more information. It was easy internally, but it was with the kind of like the organising committee, the polyclinic teams, the kind of like the cross-government people, that it was more difficult to get that engagement and get that learning, and we didn't get as much as we would have actually really liked. But from a public health perspective, we got robust feedback, because it's also an opportunity for people to kind of like offload, get rid of their frustrations, plus the positive. And 85% of it was positive, but things worked better in some places than others because it's people. But it just gives people a chance to kind of like talk about their experiences, share them, offload a bit, but also really celebrate. So it's definitely a useful thing. And my plea to Paris is to document stuff, share it with the world. You'll have that experience. It's far more personal. My aim is to retire after Paris, so I don't have to do it again. It's a good opportunity, and it's an amazing thing to be involved in and tell that story and share it.
Great. Thank you very much. I would like to close the starting and thanking you all for coming here. And I think that the wealth of your experiences and the complexity of managing such mass gatherings is shown by the different actors involved. There is a big variety of actors, and all of them work together, and we've seen it in all of the presentations that it's an exercise that requires many different people with different knowledge, and working all together, I think, is something that it's key. And after that, I would also like to thank you, the audience, for coming here, and the questions, also the people online for the participation and the questions asked. Santé Publique France also for organizing this session, which I think is very important, and also for inviting me, and also for the co-moderator for everything and all the preparation. And thank you so much.
Thank you.